Hi, my name is Sahar Siddiqui, and I'm one of the cardiothoracic surgeons here in Rochester, Minnesota. Thank you for joining us, and welcome to The Deepest Cut. Here, our goal is to really get beyond the surface and understand how background, culture, and hardship has shaped our team, including our surgeons, leaders, and our professionals. I have the pleasure of introducing Dr. Juan Crestinello, who is the Department Chair for Cardiovascular Surgery here in Rochester, Minnesota. It is truly an honor and a pleasure to interview him as one of the very few minority department chairs in cardiac surgery. I can imagine having that title. It's been quite an up and down adventure for you to get to this spot. So I'm really looking forward to hearing about your journey to becoming a cardiac surgeon.
Thank you, Dr. Sadagi. It's a pleasure to be able to speak to all of you about my personal story. I was born in Uruguay in South America, and I trained in medicine there. I went to medical school, and after medical school, I made the decision that I wanted to be a cardiac surgeon, and as such, the best place to train as a cardiac surgeon was in the United States. And obviously, coming from abroad is not easy. And at that time, there was no internet, and the way to learn about the steps that needs to be taken in order to train in the United States was by the word of mouth. And then, based on that, we learned that there was a series of tests that we have to take in order to be able to train and then eventually practice in the United States. And we took those tests, and then when I applied for residency, it was obviously not qualified to become to get into the residency, general surgery residency program, and therefore I started doing research for 3 years. And after that, I started general surgery, and then I came to Mayo, and I was as a trainee in thoracic surgery, and I finished my training. And after that, I became an attending first at Ohio State, and then I came back to Mayo 5 years ago.
And that's an incredible journey. I mean, to have those hardships along the way, like nothing was ever handed to you, and to fight through those ups and downs. How did you stay so resilient through all of that?
Well, I always wanted to be a cardiac surgeon, and it's important to have a focus on what you want to accomplish, and also use every single opportunity that is, or every single door that opens to you, in order to use those opportunities and being able to be successful. And obviously, it's a question of how hard you try, the opportunities that open to you, but also it's very important to be aware that there's many people down the road who help us. There's many individuals during the course of my careers that they took a chance on me, and they allow me to succeed and be where I am today. And without their support, mentorship, and advice, but more importantly, having given me a chance and taking a risk on me, on somebody who came from South America, who was barely able to speak English when I started, took a chance and allowed me to train and succeed.
That's it. That's truly incredible, to hear about that. I mean, just from not having, a lot of English and now being chair of cardiac surgery, that's truly amazing. When you sort of think about your background and those experiences, how has that interactions helped your patient care and you as a surgeon?
Well, I'm very sympathetic with people who are not from the patients who are not from the United States, and they are having a serious health situation, and they are having difficulties to communicate with the healthcare team. And that's a situation that when I face with, I put myself on the situation of the patient, and how difficult it is to be being in a foreign land, not being able to speak the language and being sick. So trying to use all the resources that we have in order to translate for the patients, as well as being able to spend the time and explain whatever situation the patients are going through, and also understand the cultural issues that are that different patients from different parts of the world have, and how they react to their disease, and what their expectations are.
For sure.
And those things are different for different individuals from different backgrounds.
Yeah. I'd like to go back to some of that resilience that you had mentioned about these doors that opened for you and you were able to get to where you are. I'm sure that through that process, a lot of doors were shut. So when you saw these doors shutting for you, how did you sort of get beyond that? Did you lose hope in yourself, or how did you maintain that focus through those things?
Well, I think that this life is an up and down, and you have you have opportunities that open to you, but also opportunities that have closed to you. And at the end, is the summary of all those opportunities that make your journey, the positive ones, the negative ones. But every situations where you have, as you say, a door that shuts, later on there's always a doors that open. And most of the time, the opportunities that came after that door closed are better than the opportunities that you potentially would have had if the first door had not been closed. So I think that it's important to stay focused. I think it's important not to lose hope, and have the determination, as well as the support system to allow you to go through these things. I was fortunate always to have this support, the support from my family, first from my parents, but then after that from my wife and my children, who were essential in order to achieve all the successes that I had achieved. But also all my mentors and my colleagues,
Definitely.
like you, who really are essential in order to support our daily activities.
So I wanted to just touch on bias. It's all around us. And as the chair of cardiac surgery, I'm sure that you face bias and your team faces bias. So how do you handle that, and what advice do you give to people?
Well, I think that bias prevents our ability to assess the situations correctly. I think that we have to be curious and learn about what the situation is. Ask questions about the background, about different individuals that you're dealing with, what perspectives they have, what backgrounds they have, how those backgrounds and perspectives have affected the way that they react, or the way that they face the day-to-day activities at job, at home. And so having the time and effort to inquire about all these different perspectives in an active as well as in a passive way, in a way that every time that we interact with a different person, or a patient, or a member of the team, and put ourselves in their situation, it helps us to overcome that potential biases.
Yeah, I think you sort of bring up two important points. One, as we diversify our team, it actually provides better care to patients because we have more perspectives to give. And two, sort of the internal talk that when we're faced with bias, that we have to sort of step back and say, let me try to share my background to help educate the people in front of us and say we're actually more similar than maybe meets face value. So thank you for that. And I appreciate you taking the time today.